National Heart, Lung and Blood Institute, National Institute of Health, Bethesda, USA. Dr. Kruth has done pioneering work in the area of cardiovascular disorders, especially atherosclerosis. We would thankful to Dr. Kruth for agreeing to answer some of our queries related to cardiovascular disorders, especially atherosclerosis. Now, my first question to you, sir, what are the most common cardiovascular disorders and why they happen?
Well, of course, I'll focus on atherosclerosis
Yeah.
since there are quite a few cardiovascular disorders. But the process of atherosclerosis is the buildup of cholesterol in the blood vessel walls. And depending on where that buildup occurs, it can cause different manifestations of the atherosclerotic process. So when that buildup of cholesterol occurs in the coronary arteries, it can cause blockage of blood flow to the heart, and this can lead to a heart attack. If this buildup occurs in the carotid arteries that deliver blood to the brain, this can lead to a stroke. And buildup of cholesterol in the vessels that deliver blood to the lower extremities, the legs, this can also cause problems in terms of loss of function of the lower extremity.
Now, my second question is how we can easily detect or diagnose these disorders, and what would be the best or economical test to detect such disorders?
Well, sometimes they're not very easily detectable, and that's why people are surprised when they come down with some of the atherosclerosis-based diseases. However, when you go to your physician can do an electrocardiogram, because when there's a decreased blood flow to the heart, this affects the electrical activity of the heart, and this can be monitored with an electrocardiogram. Sometimes the physician may have you do some exercise to try to stress the heart to bring out this property of decreased blood flow. You can also ask your physician to actually take his stethoscope and listen to the carotid arteries in your neck, and when there's a blockage, this disturbs the flow of blood, which actually causes some sound that the physician can hear. And if the physician hears this kind of abnormal sound, then the physician can order an imaging test to look at the carotid arteries by a technique called ultrasound. Perhaps the simplest technique that can be used to look for any kind of buildup of plaque in the blood vessels delivering blood to the lower extremities would be something called the ankle brachial index. And this is basically where the physician can measure blood pressure in your arm and compare it to the blood pressure in your leg. And if there's a great difference, this can be an indication of some blockage of blood flow to the leg. So these are the initial, perhaps simple tests. Of course, if you have some kind of symptoms, this will also be, in a sense, a way that lets you and your physician know that you have a problem. And of course, with blockage of blood to the heart or the lower legs, this often will result in pain. Blockage of blood to the brain can, of course, affect various brain functions where you may have weakness or abnormal sensations in your face or your extremities, and you may have problems with your vision, or you may have problems with your speech. So these are all symptoms that would cause you to go and be examined further.
Okay. Now my third question to you, sir. What is your opinion on lifestyle modification to prevent cardiovascular disorders?
Well, probably the most important lifestyle modification would be for those people who smoke. It's not only does smoking cause lung cancer, but it also contributes to the development of cardiovascular disease, especially atherosclerosis. And so stopping smoking would be probably the best lifestyle modification you could carry out to decrease your risk of developing those diseases. And of course, people talk about exercise and diet as also being important.
Okay. My next question to you, sir. As there are overwhelming evidences for involvement of macrophages in cardiovascular disorder, I would like to know your view about how these cells can be selectively targeted for preventing disease progression.
Well, first we have to know what the macrophage is doing in terms of promoting the development of atherosclerosis in the blood vessel wall. So this is a cell that we know accumulates cholesterol, and as I mentioned, cholesterol buildup is one of the key elements in the development of this disease. However, it's not so clear, even to myself who's been studying macrophages for many years, whether they're trying to help remove the cholesterol from the blood vessel wall or whether they're actually responsible for it being deposited. So we have to do some more research. People like yourself who are interested in this area,
Definitely, sir.
trying to understand which aspects of the macrophage biology are helpful and which ones are sort of causing the disease to progress. And once we understand those functions and how they fit into the disease pathogenesis, then we'll have a better idea of what functions we want to target in terms of inhibiting, and perhaps what functions we want to promote. So it is still a complicated question.
Yeah. My next question to you, according to you, which is the most exciting discovery and development in the field of cardiovascular disease which has the potential to benefit the patients?
Well, I guess these kinds of discoveries come very slowly.
Yeah.
And perhaps initially, the study that established the risk factors for development of cardiovascular disease, the well-known Framingham study that identified some of the things we've talked about already,
Yeah.
Elevated cholesterol, high blood pressure, and of course smoking as contributors to the development of atherosclerosis. That study, of course, was carried out in the 1960s, and it's, of course, was very important in terms of modifying how we approach the disease. Over the years, there's been techniques that have been developed to try to open up obstructed blood vessels, especially in the coronary arteries, and these surgical techniques and mechanical techniques have been very helpful. And of course, there's the development of drugs to lower blood cholesterol.
Yeah.
So these most people are more familiar with, and certainly that's made a very significant contribution to decreasing mortality and morbidity from cardiovascular disease based on atherosclerosis. However, even for some of the best classes of drugs like the statins, although they certainly have a dramatic effect in improving atherosclerosis and, for instance, heart attacks caused by atherosclerosis in a third of the people, still the majority of people are not helped significantly by these drugs. So we need to do a lot more study,
Yeah.
find a lot more targets,
More
develop a
targets.
lot more drug approaches.
My next question to you, sir, in your opinion, what is your view on targeting cholesterol in the treatment of dyslipidemia and cardiovascular diseases?
Well, as we just discussed, cholesterol is certainly an important element, and it's something that can be easily measured in the blood. But we know, in fact, for instance, that, again, from the Framingham study, that LDL cholesterol, which is the major carrier of cholesterol in the blood, is a risk factor for developing heart disease. However, just knowing your LDL cholesterol doesn't give you a good indication as to whether you're going to suffer, for instance, from a heart attack or not. We just know that lowering it is beneficial. So cholesterol is certainly part of the story, but there's a lot more that's going on in the vessel wall itself that we need to understand in terms of why that cholesterol is accumulating, why it's not being removed from the vessel wall. These things are much more difficult to study than just studying the levels of cholesterol and finding ways to lower, for instance, LDL cholesterol. And that's why we don't have yet drugs targeted to those processes.
Okay. My next question to you, sir, in your opinion, what are the present challenges in the field of cardiovascular drug development?
Yeah, so again, following up on the last question, those challenges exist in terms of trying to understand the biology of the disease in the vessel wall, and trying to establish animal models that really reflect the human disease. So there's great interest right now in using mouse models of disease that are typically based on very, very high levels of cholesterol to induce the disease. But as a pathologist, when you look at the human disease and you look at the disease, for instance, in a mouse model of atherosclerosis, you see that they don't look very similar. So that mouse model may be only telling us about some very specific aspects of the disease, but may not really be the best model in terms of predicting what drugs and therapies are going to be useful in humans. And of course, the second thing would be actually having the capacity to do large-scale clinical studies to test drugs that are not just causing cholesterol to go up or down, but rather clinical studies would be actually assessing the degree of disease when the target is actually some target in the vessel wall itself. For instance, as we talked about earlier, if you were going to try to target some macrophage function. So these studies, of course, take many patients and many years to complete, and along the way you don't have something very easily measurable like we do with, for instance, cholesterol levels. So I think those are the major challenges as we go forward.
Let's finish our talk. That's a wonderful talk on behalf of myself and CSIR-CDRI. I thank you, Dr. Kruth, for sharing his view with us.
Oh, it's my pleasure. Thank you very much.